Hello, everyone. My name is Dr. Lauren Wood Thum, or I go by Dr. Wood at the office. Thank you so much for taking time out of your busy schedule to join us this evening. We will be recording this and uploading it later, so if you miss anything, we're happy to fill you back in. As I said, my name is Dr. Wood. I work here at Urology Specialists in Sioux Falls, South Dakota. And so we'll talk about some common pelvic floor disorders. And if any of those things are troubling to you or family members, please don't hesitate to reach out to us at the office and let us know how we can help. Chrissy, can you do me a favor and just X out that poll because it's right in the middle of the screen. I can't see the slides.
Yes, I will do that
Thank
right
you.
now. 1 second. There you go.
So if you are bothered by symptoms of urinary incontinence, leakage of urine, stool, frequency, urgency, know that you're not alone. And 48% of people with these overactive bladder or fecal incontinence symptoms reported loss of confidence. And more than 64% of people experiencing those symptoms are not currently using any treatment, which is crazy to me when you think about how negatively that would impact your quality of life if you're having constantly centering your life around running to the bathroom. Will I be able to maintain a job here? How can I go on a date? I can't leave my house. I can't be social. These are real things and real stories that patients tell me all the time and how negatively it impacts their life. And it's time for a change. So bladder and bowel issues are not inevitable. Okay. I hear a lot of people say, well, it's a normal part of aging. It's not, and it doesn't have to be that way. So if you are urinating more than 8 times a day, that would be about every 2 to 3 hours when awake, or you have the gotta go feeling, or when you walk into a store or an event, you know where every bathroom is, you're constantly thinking about not eating or drinking too much for fear of having an accident, if you're wearing pads or you're getting up multiple times, that means your body's trying to tell you something, and that's not normal. So just know that you are not alone. Bladder and bowel issues affect millions of adults. 1 in 6 US adults is affected by bladder control, and 1 in 12 with control of stool. And I think those are probably conservative estimates, as a lot of patients do not seek treatment. So if these things are affecting your sleep, your confidence, your self esteem, just know that it's not normal and there are treatments available to help you. So, as I mentioned, the good news is there are treatments. So, let's learn a bit more about those. So, first of all, what causes this problem? Well, if I knew, I'd probably have a much bigger house, right? But we don't know what causes these. We think it's a brain bladder miscommunication, but there are things you can do that make it better or worse. So, your daily habits, including what you eat, what you drink, how much water, how much caffeine, medications, diuretics, for example, or some medications that have GI side effects, gastrointestinal side effects, or pregnancy, childbirth, or prior history of pelvic floor injury can all be contributing factors. So, how does bowel and bladder control work? Well, it's essential for the brain and the bladder to communicate. And the leading hypothesis on why people have accidents is because there's a miscommunication between the brain and the bladder. The great news about Medtronic and the Medtronic neuromodulation devices that we use are that they help restore that normal communication, and it's not just putting a band-aid on the problem. So common pelvic floor disorders that I see patients for in my office include stress incontinence, urinary retention, overactive bladder or urge incontinence, and also fecal incontinence or loss of stool. So what is stress incontinence? Stress incontinence is leakage of urine with activity. Think coughing, laughing, sneezing, bending, lifting, and sometimes this will coexist with urge incontinence, and that would be called mixed incontinence. What is urinary retention? Well, urinary retention means basically you can't empty your bladder. It can be complete urinary retention requiring a catheter, or it may be partial retention or incomplete bladder emptying, where maybe you don't need a catheter, but you still can have really bothersome symptoms. Overactive bladder is the gotta go feeling. Frequent urination, a strong urge to urinate, not making it to the bathroom in time, regardless of how much fluid you drink. Some people will say, as soon as I turn my key into the door to get home, I start leaking, or I can't make it to the bathroom to get my pants down without having an accident. And if you're wearing pads or protective garments to avoid these issues, that's another sign of overactive bladder. Typically, like we said, going more than 8 times a day as well. What is fecal incontinence? Well, fecal incontinence can be related to a strong urge to have a bowel movement, or can just happen passively and you may not even realize it, but essentially it's the loss of stool, and it's involuntary. So if you have stained underpants or are using pads because of a loss of stool, this therapy might be right for you. So there are many ways to treat incontinence and get back to life. And we think about these kind of in a stepwise approach. Typically, we start with lifestyle changes and then, if applicable, go on to oral medications. And thankfully, there are more advanced therapies for patients that don't respond to those initial conservative therapies. So lifestyle changes, what can you do right now to help your bladder and bowel? Well, when it comes to urinary incontinence, I always tell my patients, only drink when you're thirsty. If you have a normal thirst mechanism, you do not need to be drinking 8 glasses of water a day. There's no medical textbook anywhere that says that that is the appropriate amount of water. Just like there's no set number of calories that a person should intake. That's going to change based on the person. And thankfully, our bodies are so smart that we have thirst and hunger to know when we need to eat or drink, and we don't have to push fluids, as I think this has been a common misconception in the media nowadays. And I think it really coincided with the advent of bottled water, because if you think back to, when we were kids and younger, we didn't have bottled water. We were not admitted for dehydration to the hospital frequently. So you don't have to worry about getting dehydrated as long as you listen to your body and follow your thirst cues. So that's step one. Don't drink unless you're thirsty. Step two, I know I love my morning coffee, but caffeine is a diuretic, and caffeine can irritate your bladder and your bowels and cause accidents. And so I think it's acceptable to have one in the morning if you're someone who likes caffeine, but any more than that, and you may be doing yourself more harm than good. Sometimes physical therapy can be appropriate, although I find that that's more helpful in the case of prolapse or incontinence in patients who that would be indicated for. And you can try Kegel exercises, although you have to be careful with these, because if you have pelvic pain, you can actually do more harm than good with Kegels as well. There are also oral medications available, not for fecal incontinence, but for urinary incontinence. And compared to when I was in training as a young urologist, the medications we had available then were really awful. They cause dry mouth, blurry vision, constipation, and most importantly, a lot of medications for bladder control contribute to dementia. And so I really don't use most of the older generic available drugs because I do not think that they're safe, and I do not prescribe them for patients. There are newer drugs available, thankfully. The downside to these is one may cause high blood pressure and the other is quite expensive. And so even though it may be a great option and may be very therapeutic for patients, it's not always affordable and it may not be available to all patients. So in some scenarios, we're able to use medication, and that's great. It would be great if it just stopped there, but it's not always the end of the road for a lot of patients. So luckily we have advanced therapies. So for bladder control, we have 3 main advanced therapies, and I'll go into those in detail. And for bowel control, really, it's just neuromodulation. There are some older surgeries that existed for a while, but really when it comes down to it, that's going to be the best option for fecal incontinence. So for urinary incontinence advanced therapies, one option is a Botox injection. This is a great option for people who live close by, are fine coming in every 3 to 9 months, an average of 6 months, where we inject a neurotoxin directly into the muscle with a very small needle through a camera in the bladder. And the effectiveness is similar to oral medications. Now, this does not address the brain bladder communication, but it doesn't mean it doesn't work. There is a low but potential risk of needing to self-catheterize temporarily. And so that's something that usually deters patients. Another reason why we wouldn't be able to use Botox is if a patient has recurrent urinary tract infections, as it may contribute to bladder infections. Tibial nerve stimulation is also a great treatment that mimics the efficacy of medication. The downside I would say to this is that it's a little time consuming. So patients have to come in once a week for 12 weeks for 30 minutes and then monthly thereafter. I think the upside is there's, very little risk. It's non-surgical. There's no risk of catheterization. You just have to have the time and the commitment to be willing to put that in. But if so, this may be a really effective treatment for you. And then finally, we have sacral neuromodulation with the Medtronic system. So the one benefit that the neuromodulation has over other treatments is that it actually directs treatment against the condition being the brain bladder communication by gently stimulating this third sacral nerve, one of the nerves that helps control brain and bladder function. The great thing about this is we test it in the office before we ever go to surgery. And so I think a lot of people are very turned off by the idea of surgery, but we don't implant the device unless we know it works. So we have a quick, about 5-minute procedure we do in the office with a little laughing gas and some numbing medication. And patients are able to try this treatment out at home for a week and see how they feel. And if they're happy and they have at least a 50% reduction in their symptoms, then we're able to move on. And so we have a great way to review this with a bladder diary before and after, so we can really have good data to see how it works for patients. So let's say you're urinating 15 times a day and waking up 4 times at night. During that test phase, you may find that now you're only going to the bathroom 8 times a day and waking up once or twice at night. So if you meet that 50% threshold, then you would be a great candidate to move forward with the therapeutic implant, which is a same day surgery. And it's an outpatient procedure, very similar in terms of anesthesia to a colonoscopy. So it's sedation. There's no breathing tube. It's the same day in and out. What's great about the Medtronic system is we have this My Journey app that's just available. So if you have a QR code, and we've left this slide up for a while, so hopefully you can scan that if you need, you can kind of see how the app works. You can talk about, or you can document how many times you're urinating, when you're getting the urge, when you're changing your pads. It'll walk you through everything and you can easily track your symptoms. And if that's too confusing, or you're like my mom and you're a boomer, it's okay to just do pen and paper. We can use that too. The other great news is that the Medtronic system has advanced to be MRI compatible. So this was an issue back when I was in training where sometimes we would have to explant or remove the devices if patients need MRI. Now we know that it is very safe and you can have a full body scan. Millions of people have had InterStim devices and MRIs very safely. And so that's another great benefit of this treatment. So how do we know if this therapy is right for you? Well, if you have significant symptoms, if you've tried the lifestyle changes, the cutting back on the fluids and caffeine, and you failed medications, and you haven't found the relief you wanted, you very well may be a great candidate for one of these advanced therapies. So with the InterStim device, 84% satisfaction among those who are using it for bladder control, 3 times greater improvement in quality of life compared to medications, and 89% of people using the Medtronic bowel control therapy experience long-term success with nearly 500,000 implants over the last 25 years. And I can tell you from our own data here at Urology Specialist that 9 out of 10 patients that have the test phase completed end up going on to surgery and being very content with their symptoms. So this is Alan. He's an InterStim ambassador saying, I can do so many things I want with less worries. It's so empowering. And I've seen that day to day with my patients who are able to attend their daughter's wedding or go to church without the fear of leakage and without having to spend all that excess money on pads. So if there's any questions, I think Christy is our moderator and can kind of help facilitate those. Feel free to type in the chat box. Like I said, if this is something you've ever want to discuss further, please don't hesitate to reach out to me at the office at Urology Specialist. And I thank you all so much for being here this evening and taking time out of your busy day to hear our presentation. And thanks to Medtronic for facilitating this event.
Thank you, Dr. Wood. Like she said, if you guys have any questions, please enter them in the chat box at the bottom of the toolbar, or there's a Q&A box that you can enter them as well. And we're just so thankful you guys spent your Tuesday night with us. So we'll give it a couple minutes to see if anyone has questions. Otherwise, we'll let you guys get back to your evening.
Christy, this is something that I hear in my office all the time. Maybe I'll start. So one
Yes,
question is,
perfect.
with the Medtronic system, how do you control the device? So there's a couple different um, options available on the market that are to use for neuromodulation. The reason why I like Medtronic is because there are several programs. And I think of it like a radio. You can turn the volume up or down, so you can turn the stimulation up or down, or you can change the station and go to a different program, 1 through 7. And some people find 2 or 3 programs they really love, and sometimes it's trial and error. And so I like the variety available. I also like that there are rechargeable and non-rechargeable devices. I definitely have a bias. My bias is for the non-rechargeable because if it were me, I would want to set it and forget it. And those batteries last 10 to 15 years. With the rechargeable device, you do have to kind of think about it at least a half hour every week. And so my preference is non-rechargeable, but we do have options. So I appreciate that.
Perfect. And we do have one that came in.
Yeah.
I've had a few Botox treatments every 6 months. The last time, which was maybe 6 weeks ago, is not working very well. What would you recommend?
So typically, when Botox has been working and then stops, I think of 2 things. One, do you have a bladder infection? So I would check a urine. And 2, are you maybe not emptying well? So I would check a pulse void residual in my office. Unfortunately, this does happen though. And so we think that some people actually develop antibodies to Botox, which can develop over time. And prayerfully, that doesn't happen to me, or these forehead wrinkles are going to get really bad. But that is something. So there are studies to show that there is some treatment crossovers. There are a number of people who will start with medication, end up with Botox, and ultimately end up going to Medtronic, InterStim, and vice versa for whatever reason. So I think that'd be a great question for your doctor to get a urine specimen, a post-void residual, and talk about other treatment options.
Perfect. Just another question that we saw come through. Do you know like insurance? Is this covered by insurance in the treatment options?
Yes. So my least favorite topic in the world. So every insurance plan is different and it all comes down to deductible. But in terms of, is it a medically necessary procedure that is covered by insurance? Yes, we get prior authorization before doing any of this. So we're not going to, no one's going to get surprised with a big bill. And then depending on your insurance, yes, we're always going to get it approved. And then they all should be relatively affordable. And those are things that my office can help. We have a patient financial representative who can look at a case by case basis because it really does vary whether you're private insurance or Medicare or what your out of pocket deductible is. But this is not a nose job. This is not, cosmetic surgery. This is covered by Medicare. These are real medical diagnoses, and which is weird because they don't cover the medication, but they will cover advanced therapies. And that's certainly something that we can help with if that's a concern.
Perfect. We do have one question come in just about some symptoms, so I'm going to ask that, and then I think we can wrap it up. They have symptoms that are greatly reduced by medication and lifestyle changes, usually 80% of the time. But there's a few nights, maybe 1 or 2, where everything kind of goes off the rails. Could this be related to prostate cancer, or should I consider getting an InterStim?
Okay, I think, well, so question 1 is, do you have prostate cancer? If so, that would definitely be a question for your urologic oncologist. The other thing is you'd have to look at the individual evening. So is it a night where you had a couple glasses of wine with dinner? Is it a night where you took your pills later and maybe were drinking water up until bedtime as opposed to cutting back at supper? I think anytime you have a change in your baseline symptoms, it's definitely appropriate to be evaluated by your physician, again, with a urine specimen, an ultrasound, maybe a bladder diary. But if all of that comes up normal and it's not related to a cancer, then if lifestyle and medication is not enough, I think it's absolutely you'd be maybe a candidate for advanced therapy.
Great. Thank you so much, Dr. Wood.
Yes.
I don't see any more questions in the Q&A or chat box. For those on the line, there is another poll just to see, your thoughts of the presentation. So if you can answer that before leaving, that would be great. Otherwise, that is concluding our presentation.
Thank you all so much for being here. I appreciate it.
Thank you all. Have a wonderful night.